Wait, Sam. Good afternoon, everyone. Testing, testing. Can everyone hear me? Yay, hello. Welcome. All right, welcome and thank you all for joining us today. And just so we can have an idea, is this anyone's first webinar with eLotus? If so, please type first in the chat room. First. Oh, awesome. 很多都是第一次来的，第一次来。
有些第一次。
对。Awesome. All right, and then next question. Is this anyone's first class with Dr. Diao? Please type new in the chat room if you are new to Dr. Diao's class in particular. Oh, wow. 很多新的学生。对。他们一直打。Awesome. Wow, so many people. Welcome, you guys. We are so excited for today's webinar as we have so much to share with you today. You are definitely in the right place at the right time to elevate your skills for 2026. Next question, last question. Dr. Diao would like to know how many years you have been in practice. Please enter the number of years you have been in practice in the chat room. And if you're a student, enter student. Let's see here. Wow. Okay, let's start from the top. 25年、12年、30年、26年、8年、3年、23, 11, 46 years, 23 years, student, 1,000, half a month, awesome, 33. All right, awesome. What a good mixture of veterans and also students. But I don't see anyone with 50 years. I see the 1,000 years though. Awesome. So you will all learn something new today. I can guarantee that. And after 50 years in practice, Dr. Diao has compiled 30 pro tips for you. We are so lucky to have him share his clinical experience with us today. Have you ever wished you could stand beside a master acupuncturist and watch exactly how he treats back pain for fast, reliable results? If you're ready to step into Dr. Diao's clinic and intern directly with him, type yes in the chat room. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We truly appreciate you all for joining us today. Now, today's class has 3 groups. The first group is our Watch It Free group, which means you signed up for this class with a coupon code to watch free with no CEUs, video replays, or lecture notes. So you better get your paper and pen ready to take notes. However, you can upgrade to our second group, the paid group. This group will receive access to the CEUs and video replays for 4 weeks, plus downloadable lecture notes. If you are from the Watch It Free group, I highly recommend you to upgrade ASAP because we are playing 3 carefully selected cases today for you. And when the distance learning courses are available for replay, we have more bonus cases for you to learn from. And finally, we have our premium group, our Gold Pass members. Are there any Gold Pass members here with us today? We'd love to hear from you. Our Gold Pass members are automatically registered for live webinars and have access to the CEUs and video recording like this class and 8 more of Dr. Diao's classes for free and 300 plus more classes from 200 plus speakers. Basically, unlimited CEUs. Plus, there are sponsored benefits. This includes a 10% discount from Helio and an Evergreen Herbs Collection Formulas voucher from Evergreen Herbs that is equivalent to the amount you paid for the Gold Pass. And for today only, we have our Gold Pass webinar special. I will mention further details about our Gold Pass webinar special later on today, and I will also send the link to today's special in the chat room for you shortly. And today's class is straight to the point, Ashi Acupuncture for back pain from 50 plus years of experience, sponsored by Evergreen Herbs. In this class, you will gain access to hand-picked, pre-recorded clinical footage from Dr. Diao's own practice and real patients, so we can show the best case demos for you to learn from. He will demonstrate his time-tested approach to treating back pain, palpating and selecting Ashi points with precision and applying needling techniques designed for rapid and effective pain relief. And it is my great pleasure to introduce today's speaker, Dr. Kai-Fong Tiu, a master acupuncturist with over 50 years of clinical experience, specializing in sports injuries and musculoskeletal trauma. Dr. Diao is renowned for achieving fast, often immediate pain relief through his refined palpation and needling techniques. He formerly served as a professor of orthopedics and traumatology at the Chinese Academy of Traditional Chinese Medicine and holds a diploma in orthopedic and chiropractic medicine from the School of Medicine in Jinan University. His decades of clinical mastery and teaching make this an exceptionally rare and valuable learning experience. We also have Tina Chen, licensed acupuncturist and herbal consultant for Evergreen Herbs, joining us today live from Taiwan to present and translate today's webinar. Additionally, I wanted to mention that Dr. Diao has many other distance learning courses on Ashi points with eLotus, including how to treat chronic, acute, neck and shoulder pain, and more. And this year, he is presenting a brand new series of courses on his most recent cases of Ashi points for neck and shoulder pain on March 30th, hand and foot pain on April 27, elbow and arm pain on July 27, and knee and leg pain on November 16. They will all be on Mondays, so it's super easy to remember. If you're interested in learning more about his courses or learning more about Dr. Diao, I will also send a link to these courses shortly. And before we begin, a quick reminder to set your chat from host and panelists to everyone so that everyone can be part of the conversation. If you have any questions during the webinar, please use the Q&A box. And the quiz for CEUs will be available the next business day, late afternoon, for everyone with qualifying attendance. And remember, if you are signed up to watch this webinar for free, there is still time to register as a paid attendee to receive the CEUs, video replay, and lecture notes with all its time-tested tips and more. Now, without further ado, please join me in welcoming Dr. Kai-Fong Tiu and Tina Chen.
Hello, everyone. Good morning.
Hello.
Can everyone see me and hear me okay?
Yes.
All right, wonderful. Thank you very much. So it's great to see a lot of old friends here. I recognize a lot of names and a lot of new friends. And it's wonderful to see that, wow, we have people practicing for 20, 30 years. So I'm so excited that you guys are here, that you can share your experience, hopefully in the chat room with us too today, as I go over the tips from Dr. Diao. And then if you have any feedback, please put it in the chat room so that we can learn from one another. Because, you know, if you have been practicing for over 10 years, 20, 30 years, I know you guys are as passionate about TCM as we are, or as I am, you know? So wonderful to see you guys here. All right, I'm gonna go ahead and share my screen, Dr. Diao's notes. And I think what he has to offer today is really very valuable because Dr. Diao is not only a a practitioner that we met in an association, but also a family friend. And for him to be, so excited about Chinese medicine like we are, he has a lot of knowledge, of course, and we basically picked his brain for you because because he's a family friend. He used to always tell us his secrets, not like a regular Chinese doctor, old Chinese doctors. Usually, when you learn from them, you have to. I'm not sure if you're aware of the process. Is pretty much you have to go to their clinic, bring them a lot of gifts, and then pay a lot of respects, and maybe over a year sweep the floor and volunteer at the clinic for them to tell you their secrets. But Dr. Dell, because he's a family friend, he was always very generous. And throughout the years, we have tried to convince him to give a class, and finally he agreed a couple of years ago. And then, to our surprise, he was really generous with everyone too. So that is very lucky for all of us. So today we compile all his 30 tips that he has realized over the years. This is kind of like the aha tip in your clinic. Sometimes it takes half a year or a year for you to come to some conclusion that you think is very useful. And these are those aha tips for you. Okay, so today's overview of the class is going to be me giving these tips for the first 30 minutes, roughly. And then we will go into 3 case studies. We used to do it live before, but we have encountered cases of patients not showing up or patients experiencing the same type of back pain or same type of pain. So then we, have 2 redundant case studies. So then we decided to record these videos of the cases of back pain and pick the best ones, of different types of back pain, so that we can present it more smoothly for you. And then also you can see closer ups of the video, of how he does it exactly at his clinic. So those 3 case studies that we will pick and show you today, after each case study, we will have a Q&A session where you can ask questions about how he treated that patient or any other patients of yours that's similar to that patient, or whatever question you have regarding that case. And then we'll continue on to the next case. And then we will, at the end of class, after the 3 case studies, I will present some bonus material for you. We didn't do that earlier before. I included a lot of extra points for you from many different speakers that we have had in eLotus, and also my personal teachers. So it covers a bunch of different ways for you to treat back pain. You shouldn't be able to not treat back pain after today, okay? Or if you already know how very well, you might learn something new today that you haven't learned before. So that will be interesting. Specifically, I included ones on Bagua acupuncture on the head that I recently just learned. And I haven't heard anybody speak about that in English yet. This year, I will likely give a class with that doctor that I learned from in English in a style like this, so that you can learn one more protocol to treat whatever problem patients have. And then finally, at the end, the final Q&A, if there's time for that, we will answer some questions. Dr. Dell will answer some questions, and then some advice from him for new practitioners. Okay, so if you are new, if you're a student, there's so many acupuncture styles, right? In the beginning, when I first graduated, I thought, I was very German in a way. Dr. Tan said that German students always want to be very precise on the acupuncture points. And finally, after, I don't know, maybe 10 years, I realized there is no acupuncture point. Acupuncture is not really, the point is not really a point. Is in that general zone, you need to palpate for the most tender point, or wherever there's a knot, or some sort of difference in skin texture. That's where the point is. And also that the acupuncture points move along the meridian or along the channel during different times of the day. So it is really not 3 tuned from the medial malleolus for spleen 6. It's somewhere near there is the spleen 6 point. So that's what I learned, after many years, that there is no point. And then after that, oh my gosh, there's so many different styles of acupuncture, that which one should you learn? I have known people who are very good in any of these styles that I listed here, and whatever, makes you happy, whatever teacher you find more, what do you call that? 缘分 in English. It's kind of like you feel a closer affinity to. You like the style, you like the teacher, then then you go all the way studying that method. This is very much like Kung Fu. And Dr. Dell here, he's gonna teach us his personal favorite, and it is Ashi acupuncture. It seems so easy. In the beginning, I thought, oh, Dr. Dell's, your style is so simple. You just find the Ashi point and you needle. In the beginning, I thought, well, it's so kind of brainless, but as I learn more, it is not as simple as it looks to be as good as him. Because as I watch him in class and I watch him in his clinic, the key really is how you palpate and where you're actually feeling it, because many times he has asked me, feel this, and I couldn't feel anything. Just like in the beginning when I was learning pulse diagnosis from Dr. Jimmy Chang, I didn't feel anything for a year. Okay, then the second year, as I practice more, I could feel, okay, very subtle when they're talking about whatever they're talking about. You think that it's something very noticeable, but not really. Their fingers are trained to be very sensitive to notice the slightest difference, and I think that makes him a great practitioner, with 50 years of experience, because he has been doing that same thing. So when he was in Hong Kong before in the 60s and 70s, he used to do what E. Lotus was doing. He had an organization, so he invited lots of masters from China to come over to Hong Kong to give lectures. And he studied all different styles. And finally, he told me at the end, he said, whatever is the simplest is the best. So he concluded with sticking with Ashi point needling, because he feels like that's the most practical. It treats mild cases, it treats chronic cases, and it treats very severe cases. Because I have personally learned from Dr. Tan too, and the distal acupuncture, that is great, works wonderfully. But I have also seen patients who don't respond to that method. So it's very frustrating. It doesn't seem like there's one method that works for everybody. I feel like there's I don't know if I'm right or wrong, but I feel like, some patients' channels are more open and distal needling works better. And then some people, microsystems work better, like, auricular works better on them, but on other patients, it doesn't work. So I think you just need to know many different styles to treat all sorts of different patients. And this one, I feel like it's very good for very severe cases. So save this technique, I think, for the very severe cases, because I feel, number one, it is painful because he is using gauge 30 needle. And then also number two, he does do bleeding. So for some Western patients, they might not be open to that. So unless they're very, very much in pain and for a long time, they usually will want to go for the thinner needle and the longer treatment. All right, so are you ready? We're gonna dive right into the 30 pro tips. And as I go over these, it's gonna seem like it's very obvious to you, because I'm just compiling the summary, of his experience. But when you watch him practice, sometimes you might ask the same question. And you will see that for sure. In the previous classes, people ask, why do you do this? Why do you do that? But the answer is all really already in these pro tips. So maybe I will reorganize the notes next time into not just a statement of his tip, but rather a question and answer. So then this way, later on, when you have the same question, you can come back and look at it. You know what I mean? Because then you will have that aha moment thing, thinking, oh, how come I didn't realize this earlier? I have that a lot. Sometimes I ask teachers really stupid questions, or I ask them questions that I don't know the answer of, and then they tell me something really simple, and I thought, oh, why didn't I think of that? So this is kind of like that. All right, so let's dive right in. Tip 1, which is probably the most important, if I put it first, is he asked the patient to identify where the most painful point or the area is with usually one finger, if possible. Sometimes the pain is in a zone, so then it's an area, right? But if they have a one pinpoint area, it's best if you can have them pinpointed with one finger, then you know where to start looking for that Ashi point specifically. And what he's doing, number 2, is palpating for any kind of hardness or any kind of cord. Cord means like a very tight tendon or something that feels like a guitar cord. It doesn't have to be as thin as that, but you know, the idea is that it's one long string of something that is very hard. So number 3, here's what's important. He holds that point of where he finds the hardness and he doesn't let go. So when he is palpating at first, he's looking at the general area for pain, right? And as he finally finds where the hardness is, that Ashi point, he does not let that finger go. So that means that hand, which is his left hand, he usually uses the middle finger. I think it's the most sensitive. I thought about why he uses that. So I try to test myself, my finger sensitivity using the index finger, middle finger, and the fourth finger, ring finger. I feel like the third finger probably is the most sensitive just because we don't use it very often as much as the index finger. And the fourth one is just, something that is used mostly for meditation like this. But, the third finger is what he uses. And in the next tip, it will tell you that this finger that's palpating is actually more important than the needling hand. So we'll go over that in a second. So the number 5 tip here under number 1 is that in order for your treatment to be effective, every time he places a needle, he asks the patient, do you feel the numbness? Do you feel the, like the tingling or the qi sensation, the swelling sensation? Unless he gets that yes from the patient, he doesn't go on to the next point. So that's very important, okay? Any acupuncture style, if the patient doesn't feel any qi sensation, and when you're needling, you feel like you're needling tofu into tofu, the treatment is not gonna be very effective. Okay, so that's very important for new practitioners joining us today. I'm sure if you're a veteran, you know that already. Okay, let's go to the tip number 2. You want to look for the Ashi point. And then sometimes it's interesting way because patients will tell you where it is. And when you palpate around that, you cannot find it. Sometimes it's because the problem is not there. It's stemming from further away. So you need to expand your area of search until you find wherever the hard cord or the knot is. Number 3 is what I was talking about earlier, that the needling hand is not as important as the other one because the other one is going to stabilize it. So when you watch the demo, pay attention, okay? His hand that is palpating is usually just going to stay there, and then the needle will go in. And that not only IDs where to needle, but for him, I feel like the tendons or the structure might move around. So he's holding the Ashi point in place so it doesn't go away. All right. Tip number 4, Dr. Dao uses gauge 30 needles. We need to get that strong stimulation. This is very typical of Chinese style needling. Everything is very strong. Tip number 5, wear gloves as you palpate and remove the needles because bleeding may occur. And then number 6, use as many needles as necessary to relieve hardness and the pain. So how many needles do you think is as many as necessary? Can you type it in the chat room? Tell me how many needles you use the most or have used the most for your patient. Can you put it in the chat room for me? We have 3, 6, 30. I have a teacher who used to have a teacher that tells him, if you use any more than 5 needles, you're not a good acupuncturist. So whenever he has a choice of needling, for example, Li4, he will always needle the right side because that's a yang side and that's a yang channel. So you don't need to needle the inside. So every patient, he only needles 5 points. And that's Dr. Po-Shin Lin. He also have had a class with us, doing case studies. And he's a very advanced practitioner too. 10, 20, 8, 10. Okay, Dr. Dell, I've seen him use like 30 needles if necessary. So you can go up to that many or even more if necessary because if the patient's pain is a broad area, you need to use that many. But those patients are very severe, okay? Number 7, work on one area, the primary area first to attain relief. And then you will see in his case studies that, oh, patient will say, oh, that area is better, but I still have pain over here, somewhere further away. And I've heard this with Dr. Tom too, usually when they say the pain is here, the pain is really not only here, it's this whole area. But because it's most painful here, they tell you it's here. And once it's relieved, that primary area, you got to go for the secondary areas. All right. So the qi, okay? When you're needling, this question is really how deep do you needle? And then what do you do to get the qi sensation? This is manipulation of the needle. So when he needles, okay, let's say this is the knot, all right? And then your needle goes in. And then, so he doesn't want you to just touch the knot. He wants you to penetrate through the knot. All right. And then when he's stimulating, sometimes he goes up and down. Sometimes he just touches the skin around the point because that's a lot of stimulation already. So make sure here, this is the depth of the needling. Write it in your notes. You are not only touching it, you need to go in to break it up, so the body can do its magic to recover. Okay, did you guys write that down? That one is important. All right, number 9. When the patients are very sensitive to pain, these are the ones that scream a lot, even before you put the needles in, you want to do cupping first, because the cupping numbs the area and they don't desensitizes it. So then when you needle, they don't feel as much pain. That's the purpose and the reason. Okay. Next one. How long do you leave the needles in? Okay, so he has said that for patients who are acute, if you have already attained the qi sensation, you don't really need to leave it for 20 minutes, 40 minutes, not necessary. However, most patients will still prefer you to leave the needles in as they can rest. If they fall asleep, it's even better, right? And if they feel relaxed after a while, the treatment will be better. But mostly he does that to let them, in addition to that, make them feel like they're getting their money's worth because they're paying a lot, So I think he charges $100 per session. And so in order for the patient to feel like, hey, you didn't only work on me for 5 minutes, but it worked, but the patient will still feel like they want to get a little more, I remember Dr. Tan, Richard Tan, he used to get the same question from the patient, why do you only, needle me for 5 minutes? And he used to say, no, I did not needle you for 5 minutes. I needle you 5 minutes and 30 years, meaning from his 30 years of experience is when he learned how to needle you only for 5 minutes to get effect, not 40, 50, 60 minutes. All right, number 11. Tell the patient that this method of acupuncture, when they go home, they're going to actually feel more pain. Most patients will actually feel more pain. And then after the first day, after the first day after treatment, they will then subsequently feel much better because the local area is so worked on and inflamed probably, the restructuring is happening. So then there's a lot more pain after the treatment. And you need to definitely tell the patient that because they might feel like, oh, shoot, you screwed them up. That the patient feels like you made them worse, but really it's not the case. That's how this style is. The patient will experience more pain before relief. And if you use herbs, you will know that for patients with severe blood stasis, whenever I use blood movers or strong blood movers like the circulation sanjiao, anything with the bugs in it, you need to tell the patient first. You might experience more pain before relief, just because we're going in there and completely remodeling the area with the blood mover. So kind of it's the same idea as remodeling. Everything will be chaos before it's nice and pretty, right? So it's the same thing. They've had that blood stasis for years and it takes a lot. And it takes that pain to get the blood to be broken up and to, pass out. Then subsequently you might have more pain. And if you do with the herbs, you just stop for a day or you reduce it to half the dose and then you continue. But with this, you can't not really, right? I mean, you already gotten treatment, so the patient is or may get more pain the next day. And that is, I would say, at least 50 to 70% of his patients that we have seen that experience this. So make sure you tell the patient that. Number 12, if the location of pain cannot be needled, this is a question from a previous attendee before. Okay, the pain is in the scrotum, the eyes, what do you do? So then he said, then they palpate around the area to find the Ashi point. And I thought the answer was pretty good, very obvious, but I didn't think of that either when somebody first asked that question. All right, number 13, does Dr. Dale use a TDP lamp? He does, only to keep people warm, but he doesn't really use it for the effect. Tip number 14, does he use electrostim? No, he doesn't. If you have ever been treated by Dr. Tao, you know that you don't need any additional electrostim. Very powerful Kung Fu. It's very strong stimulation. Number 15, what do you do with pregnant patients? Do you needle them? Do you not needle them? No, because this is a very aggressive treatment style. He doesn't usually needle pregnant patients, especially on the back, and definitely no needling a month or more. And then also thoracic points, he doesn't recommend you to needle them. In one of the previous classes, I think it was like a shoulder or upper back pain class, he demonstrated how to needle the thoracic points, but he doesn't recommend it if you're new or if you're a student, because you can easily puncture the lung. Number 16, so we're going into bloodletting now. Definitely you need to follow the bloodletting protocol in your state or your country. And then wear disposable gloves and use those disposable cups. You can get the disposable cups from the Korean suppliers. I believe that's where he buys them. And what he does is he does dispose them, or he sells them to the patient to take them home, to sterilize them and bring it next time for treatment. So this way the patient has his or her own set of cups. They never use anybody else's. So that's safe practice. Number 17, if there is no obvious knot, do cupping first to find the knot easier. And in the case studies that you will see later, you will see that, many times he will do the cupping first, and then you will be able to feel the knot. Number 18, there are some patients with no specific area of pain. Like for example, I have fibromyalgia, everywhere hurts, In those kind of cases, you don't retain the needles. You have to tell them, okay, you have pain everywhere, but where is your most painful area? So then he will needle that first and just take it out. And then he'll ask, okay, where does it hurt now? And then he will needle again. So for those kind of patients, you do that. You just needle where it hurts the most and then you continue. But there's no like one systematic overall protocol for you to just needle for pain everywhere on the body. Number 19, generally speaking, when you're bloodletting, okay, the question is how many holes do you poke, right? He usually does 5 or 7 for mild cases. If the pain is severe, he does up to 10 or 20 or sometimes even more. And you will see bloodletting today in the case. He buys the lancet needles with the gun. You can buy it on Amazon. I think Myra has a link for you that she can put in the chat room for you. When you use the pen, it's a lot easier than poking, and it's a lot less painful because the pen goes in much faster, it puncturing into the skin. Tip number 20, when you're treating acute pain, so highlight this one. This one's important out of all the tips too. When you're treating acute pain, you want to bleed first, needle second, because you want to let go and let out that stagnation before you needle. Because if you needle and the blood is still stuck there, it won't get as good of an effect. I don't know how long it took him to realize this tip, but probably I think years. Number 21, For acute pain, severe acute pain, the more blood you can let out, the faster the relief. You can do bloodletting even twice in the same area if you want to let out more blood. You know, you don't poke on the same spot you poke on a different spot, obviously, but it's in the same area. Okay, now, how much is let more blood out? I always like to ask this question. I ask my teachers to be specific, please. Can you put in the chat room for me what you think is a lot of blood? Here, like I'm talking about more blood, right? Is a quarter of a cup a lot, half a cup a lot, or the whole cup? What do you think the definition of more blood out is? Can you type in the chat room? A quarter of a cup, half a cup, quarter of a cup is a lot, half a cup, depends. Full cup, all of them, yeah. So in general, it's a quarter of a cup or less. If he has really severe acute pain, I have seen almost 3/4 of a cup, but very rare. Half a cup is already a lot because it's a half a cup, you know. You will see it in the case demos. It depends, you know, that is good. It depends on the size of the cup, right? If you're using a really large cup, then yeah, that's a lot of blood. But he usually uses the medium-sized ones. 10 drops, that's not enough, Robert. 10 drops is not even enough for auricular bloodletting. You know, when I first saw Dr. Huang Lichun do bloodletting for the year, I was blown away. The effect is so fast, but she let out so much blood. And then I thought, you know, from school, it's just 3 drops, 5 drops, 10 drops, but this one is like the blood is flowing out, but the patient feels so much better. Pain and also high blood pressure, I've seen that, her do that. I'll put the YouTube video of bloodletting for the year, just for you to see how much blood we're talking about during break, okay? Now, the next one in this tip is bleeding will be minimal or none once the stagnated blood has been let out. It will not continue to bleed even with the suction cup because the painful area has normalized and there's no more, you know, a lot less inflammation and swelling and blood stasis. This is a very interesting phenomenon. I used to always think that, okay, if you use a suction, you're gonna draw out blood, right? Because that's just how it is, but it is not. I've seen his, you know, in cases in his clinic and also in class, once you have blood led enough, and even though you still, you know, pumping 5 times from the cup, there's no more blood that will come out. It's very interesting how that is, you know. So I don't know why. Maybe you can enlighten me if you guys have any idea why. Put in the chat room for us why you think that is. I don't really know the answer. Once the stagnated blood has been let out, there's no more blood. Maybe the blood is not at the superficial level anymore, it's deeper, so it doesn't come out. Maybe that's why, I'm not sure. Okay, what area are you bleeding? Oh, any area that the patient has pain. Okay, number 22, the tip, when treating chronic pain, needle first, then bleed after. Sorry, that's important too. Please circle this slide too. So remember acute pain and chronic pain. Number 23, after you bloodlet, tell the patient not to shower or bathe for 12 hours. The same idea with moxa, right? After moxa, you don't shower or bathe for 12 hours at least. And there's no need to put any ointment, right, on the patient after you bleed them. It'll heal itself. The skin is amazing. All right, number 24, on areas where you cannot needle, it's better to do bloodletting. Like earlier, he was saying the thoracic, right? Thoracic points is kind of dangerous to needle. So then if you don't feel comfortable, you just do bloodletting. Number 25. Okay, so what is the proper amount of blood to suck out from the cup? And also, how deep do you go in with a lancet? So those are questions that people have asked before too. and the number of pokes. So number one, the depth of the lancet is he uses the standard lancet with the pen, so that every poke is standard. The depth is standard. So there's not one that if you use the 3H needle, sometimes you go in deeper, sometimes shallower. So that's not good. So this one is more consistent. The number of pokes depends on how severe it is. Earlier I talked about it. It could be five up to 20 maybe in one cup area. And the number of pumps. Okay, so the number of pumps is important. If you just do 1 or 2, it's not enough. Usually it's 3 or 4. Or you can see until the skin turns a little bit purple, then that's good. And also the length of time. Okay, the length of time of where you leave the cup, it's usually 3 to 5 minutes or until the blood congeals. And how do you know if the blood congeals? You shake the cup a little bit, then you can see that the blood is kind of like jello, and that's when you can take it out. And the whole art of removing the cup with the blood in it, Dr. Dao is a master at it. In some of the videos from previous classes, you can see, it takes a lot of practice so that it doesn't get messy. Number 26. So what do you mean? What does it mean when you see bubbles in the blood in the cup? So those are not actually any problems with qi, or, some scholars might say there's some qi problems or something. It's just air bubbles. So that just means that, the suction is not tight. And then you need to be careful because blood might leak out, okay? Number 27, so what does it mean when the cup looks misty with water vapors like in the picture shown? That means the patient has dampness. And where does the dampness come from? Spleen qi deficiency usually, because these patients, if you see this kind of cups, you can usually tell them, hey, do you like to eat sweet stuff? Do you like to eat dairy? Do you like cold food, raw foods, right? And tell them to cut that out a bit while you're doing the treatment. During the duration of the treatment with you, the effect will be better. Because dampness also causes obstruction, right? Number 28. So, okay, well, so how do you bleed the extremities, the toes and the fingers? You can't use you have the little cup, right? The very small ones, but then, on the extremities, you can't do that because sometimes it's very bony and then there's no way to do any cupping on the fingers and the toes. So what he will do is he will just bleed the area. First, he'll bleed the joint. So this is very painful. When I saw him do the demo when, we were treating hand and foot pain, yeah, it's just very painful to needle into the joint to squeeze out the blood if needed. Otherwise, sometimes the blood just flows out naturally, right? And then, so he will bleed the joint first, and then he'll bleed where it's swollen, and then he'll just let the bleeding continuously flow out. Okay, here's a tip for you. Write this down. If you want the blood to continuously come out when you're dealing with joints or you're dealing with areas that have less blood flow, like the ear, when you're bleeding the ear, the way to let the blood continuously flow out more is to use alcohol, cotton. So you wipe the area with alcohol, with cotton ball with alcohol, and better use 70% instead of 90% because 90% dries out very fast. 70% is better. If you continue to wipe the hole, the blood will continue to come out if you want more bloodletting. And if you want more bloodletting, you do the squeezing. All right? Wet alcohol, squeeze. It'll continue to bleed. If you use a dry alcohol cotton ball, dry cotton ball, you put it on the hole, it will stop. That's a pro tip that I learned from Dr. Huang. Number 29, how long is the session? Okay, generally 5 to 10 minutes or until the blood congeals. Right, number 30, patients who are on blood thinners, can we still do bloodletting? And how about diabetic patients? All right, so he says, Dr. Dao says you can still perform bleeding, but then only when necessary. And extract only a small amount of blood. So whatever I talked about before, you cut that time in half and also cut the amount in half. right? So you just, if you let out a little bit of blood, it's already good. We don't want to cause massive bleeding. Be careful on these patients. If you don't feel comfortable, don't do it, all right? So these are the 30 pro tips. We are going to next go to the case studies. Myra, are we going to take a break first or do we go straight into the case?
Testing, testing. Okay, we can go into case 1. It's only 17 minutes. And then
Okay.
Q&A and then a break time.
Okay, sounds good. So then I will hand the lecture back to Myra and Sam, and they will play case 1. So if you have any questions regarding the case, please put your question in the Q&A section. And then after we come back, after we finish case 1, I will translate your question to Dr. Dao, and then we can go to break after that. All right? Thank you. I stop share.
Car accident a month ago. And it was a head-on collision. And after that, she has had back pain for 1 whole month.
站久掉就马上酸痛。
酸痛。
So when she stands a long time, her waist starts to become sore and very painful.
这里比较这是痛吗？
这里痛，
啊，
痛。
痛，
This area is very painful.
是这里，这里，下面还好。
下面好，但是就是站久了，里面骨头好像酸痛的不得了。
So the bottom of the waist is fine. It's about the middle of the back.
你上面，对上面，
这个疼，这个疼吗？
这里有一点，
这里还好，其他的还好。这腰伤腰爱
So L3.
那个
还有那个医生，你再推上来一点点。
啊，
这边这半边啊，这边你看一下，
这边
有没有这边可能不同，
这边
再下来一点，
下来一点，
这边，这边
这边
是不是有根筋脱的？好像。
So she says it's very painful here too.
这里没痛。
Yeah, she feels like there's a tendon that's out of place.
觉得这里会有，
这里
这里又没感觉，就是这里酸痛，就是这里要干还是酸痛。你上面。
Our next patient has mid back pain due to a car accident injury from a month ago. She says when she stands for a longer period of time, it becomes very sore, numb, and she has to wear a back brace.
里面肿还是外面肿？里面肿。
里面肿。
还有几个朋友，过一段时间过来。
划过以后就比较明显，你看。
Easier to feel the knot after cupping.
跑出来，这个。
He said the knot will just come up and it'll be easy to palpate. So he feels a very big knot in this area.
它是酸，不是痛。
对，酸痛。
酸痛。
He says
酸比
酸痛
较多。
sore,
酸痛啊，
painful.
血气不通。这个有淤血。
淤血。
So not enough blood flow going to the upper mid back area.
从那个斑刮污的地方就是扎的血就
这边比这边重，这边比较
整个。
这边没那么重。
So the left side is more swollen than the right side. So you can see the blood looks more stagnant. And the left, it's not flowing down as quickly.
很棒。哇，好喝。
Says the blood is very dark. And you can see it kind of coagulated within less than 10 minutes of bloodletting. Now he's going to insert a needle. Feel the knot in this area.
He's asking, do you feel the soreness?
Distension immediately.
So also watch his fingers. Watch his palpating finger. He doesn't move the finger. Right, see he's palpating now. You see he's holding using his third finger, holding it steady.
这个比较 OK， 不要太深。
He said not too deep in this area. 这是2寸
啊，
2寸的针。
我这个2寸。
So he's using the 2-twin needle, and he said not to go. He only went about 1 twin.
Right, again, he's using his third finger to hold it steady.
Now he's palpating for other knots.
All
right, we're gonna let the patient rest. So we're checking in on the patient, and she says her upper back is also painful.
这个另外一个问题，
什么问题？
也是筋啊，
也是筋问题，就是会抖，不会得以前的什么帕萨什么的症啊。
手抖，他手抖动。
抖动。
这里不会，就刚刚你找药，对，这里会有一。
这里疼。
So here is painful.
这里给你治一下，你要给到20块钱。
好啊。不会抖就好了。
我试试看。
So her hand has trembling.
我可以。
你肯定可以。
这个，这个菱形肌痛的，大多数是麻，引起麻手麻。
我手现在就很胀麻的。
对，手麻的，手麻手抖的就比较少。
我手抖。
So he says
抖的很厉害啊！
真的，你去问外面的大姐就知道，经常看到我抖。
So her arm trembles a
我
lot.
那试试看。
The root
会不会是什么
cause here.
不过我这个现在给你做一次，看看有没有效。
Tremors.
假如没效呢？你要是做
看脑了。
这个脑。
看脑了。
啊？
看脑袋了。
这个脑过会有没问题啊？
会不会是得什么帕萨什么东西啊？
那个老人，你多大年纪啊？
我60多了。
60多，也有了。老人痴呆就是这样子啊。
那完蛋了。
也没办法，毛主席都可以这样子。
They're just chatting. She's saying she has these trembles. She thinks she has Parkinson.
不是啊，实话是这个。
And usually he says that the rhomboid-related discomfort is often numbness, trembling is something else. So Dr. Dell usually treats one area during a treatment. To add an additional treatment like this, he asked the patient if it's okay to charge another $20, and she said, fine, you know. So Dr. Dell says, you know, the arm can usually be treated in one session. If it doesn't work, you know, they could then suspect if there's any brain issue.
对啊，他要发的时候，你手一点
So
都
her
没有
arm is shaking.
脑子根本就这样子，脑子根本没办法治。
Yeah, he said that even Chairman Mao has
对
dementia,
对，邓小平也是这样子啊。
and also Deng Xiaoping. This is degenerative issues of the brain is hard to treat. They're just
这
talking
个
about that.
退化没办法。
抓的那个什么，一等一会儿时间说很久。
The blood is very dark here, darker than the mid-back area.
我这个方法效果很好，但是呢，
He said his method is
很
very
多会很
effective,
累。
but it's very time
你们
consuming.
比其他人扎样中那个，
那你是
那个叫什么？我这个是功夫很多的，很
He
多
said,
都效果好。
I have a lot of
对医
experience,
生来，对我本身来讲很累的。
很累啊。
对啊，很烧，
and this style is tiring,
耗气啊，耗气的，
and
耗
it
气耗神的。
taxes the qi and blood quite a bit, but it's
对啊，
very
所以呢，
effective.
伤神伤气，
对，就是，所以
He said his technique is good,
年纪
very
老
good,
年纪老
but the
了
more
那
he
个东西
does,
不太
it can
想
be
做
draining.
那个教学生，到时候教这个学生接班。
那是好事啊。
对啊，到时候有人接班啊。
你家孩子是不是做这一行的？
我这个就我的不是，
啊
我的是西医，
啊
我的小孩大的小孩是西医，
哦，几个孩子？
2个孩子，2个男的，1个女的，
那都是做医的。
都是做医。那个老大是医生啊，小的是护士，
哦，
我太太也是护士。
那没有你没成传下去。
他不愿意学，他不愿意学。
Okay, let's go to the Q&A session, and then let's bring Dr. Dell on camera and then answer some questions. Okay, bloodletting. The first question is, in the state of California, that is illegal. How do you guys go around that and still keep your license? Okay, bloodletting is a very sensitive issue. Last time we contacted the board to ask specifically if bloodletting is legal or not. They said, ask your attorney or ask the health department. They never gave an answer. So maybe you can ask again, see what they say now, and also ask your attorney. I don't know what that means when you ask your attorney. So if I ask my attorney says yes, is that okay? I don't think so. I would also check with your malpractice insurance, because if your malpractice insurance doesn't cover bloodletting, maybe it's not a good idea to do bloodletting, right? Even though it's legal. You don't want to get into a situation where the malpractice insurance doesn't cover it. So that's something that you guys can check with your state organization. That's not something that, you know, we can decide for you. And practice what feels comfortable for you, okay? Let's go into the questions. Okay, the one of the question is the cup is not glass, it's plastic, it's disposable. So Dr. Dell will usually dispose them But some patients, being Chinese, they don't want to pay for cups every time, so they rather bring it back and then they clean it themselves. Okay. So 刁医师，你听得到我说话吗？
听到，你好。
有一个问题就是说 this first question, the tender point, does he needle directly on the tendon? 就有人问说他这个筋呐，会痛嘛，对吧？你在扎针的时候是点到那个筋，还是点穿那个筋？
看情况，你慢一层一层下去，你看看你碰到哪一个部位，它如浅浅、中浅、深浅，那到时候你就知道你那个针啊，到那浅浅还是中浅还是深浅，那
OK，
个你都要扎到。
OK， 好，可以。So he says that when you're needling, you're going to hit the shallow layer, after you penetrate the skin, you have shallow layer, mid layer, and deep layer. So somewhere along there, you will have the tendon, right? So this question, along with other questions, are all in the pro tips, right? Remember when I was talking earlier that you not only want to touch the tendon or the knot, you want to penetrate it. You want to go into it to break it up. So that is the answer to your question here. A lot of your questions are already in the pro tip. Maybe I'll reorganize the PowerPoint that way, so it's easier. But this is good because you're learning this way, Whenever I'm in class, the teacher just kind of tells me a statement or whatever the conclusion is. I don't remember, but until I ask the question, then I'll remember. So this is good that you're asking. So we want to, when you see the knot, you want to go through it. And then he says, depending on the case, sometimes you need to go through it a little bit, sometimes a little bit more, sometimes a little deeper. So that's the experience. And I don't know how he can teach that. It's something for you to ask the patient, do you have the dirty sensation? And then you, through trial and error, figure out what is the best depending on the patient's response. Now, the second one, how long does the relief last? 刁医师他问说，这个病人不痛之后，多久还要回来再扎？还是他就不痛了就不用再回来了？可以持续多久？就是这个效果，你的扎针的效果可以持续多久？
通常我们效果都是持续很久了，通常一次就好。
Okay, he said usually when it's just a acute problem, it's not something so chronic, one time is enough because this is a very aggressive treatment, right? A lot of bloodletting, gauge 30, very strong stimulation. Once is usually enough. It's not like the other type of milder acupuncture styles where you need to come back a couple times and the patient, improves and then kind of dips down a bit and improves more. This one is more aggressive. Okay, next question. Does the patient feel immediate relief from bloodletting or just soreness after so much manipulation? 但是他问说你给他病人放血之后啊，他们通常都会已经好很多吗？还是他会觉得那个地方很酸，因为你就是又放血又扎针这样子？
对啊，那就有酸章就一定有效的。
Okay, yes, he said immediate relief. Okay, next question. How do you clean those cups if they're full of blood? Can you soak them, rinse them underwater? Can you part where your pump goes wet? Okay, Ingrid, 这个学生问说，这个里面那个杯子里面的血要怎么样去把它弄干净会比较好？这个我来回答就好了。there's a safe way to dispose blood. If it's full of blood, you need to dispose them, safely. That you can check with the board exactly how to do that. You don't clean the cups. It's better to just use the disposable ones. Is there a risk for cross-contamination with lancet pens? I use the disposal ones safely to ensure there's no chance of contamination between patients. Okay, definitely. That pen that he uses, the lancet tip, that lancet is changed definitely between every patient. And if you want to, you can change it between, different parts of the body. But he doesn't do that. He uses one lancet for one patient. Does he feel immediate release of the knot after manipulating the needle? OK，刁医师，这个学生问说啊，你不是要先找那个硬点吗？痛点吗？那个硬点呢，我们放血之后还有扎针之后，那个硬点是不是就会不见了？
一般都会不见了，都软下去。
Okay, so Kelly, your question, if the knot disappears or immediate release, he said generally yes, it will either soften or disappear. Okay, next question. I have the exact same question, Nina. Is it legal in California? Okay, please check with the board. Ask them a very specific question. Tell me where on the, in the laws and regulations, for what is defined as bloodletting for our acupuncture license, is it legal or not legal? Have them show you the exact verbiage, so then you can determine what you want to do. All right, next question. So he's not rotating or dispersing, just slow, deep insertion. Correct. I don't know if you notice after he needles, he would push on the skin next to the needle, and that is his manipulation. He doesn't, like in between the 30 minutes that the patient is lying in bed, go and stimulate the point. No, because when he's needling, he's already fishing and already getting the dirty sensation, and that's enough. Is the bleeding draining for the patient and for the doctor or just the patient? 刁医师，学生问说，这个放血啊，你刚刚说就是这个又耗神、耗气、耗血，这个放血这个动作是对病人跟对医师两个都很耗气、耗血吗？还是只有病人而已？
一般这种放血对于病人没影响，没影响的，就是我们医生这种做的比较累，很累，很累的。
He said the bloodletting doesn't affect the patient. They will only feel better with the release of the stagnation, but it's tiring for the doctor. It's draining for the doctor, meaning that, you know how when you see a lot of patients, and you're around sick patients, what do you call that kind of qi? Like the sick qi will affect you. And when you're bloodletting, that actually comes out even more because, there's actually a hole. The theory is that the protective layer of the patient, is being broken because you're bloodletting. So the more of that sick qi will come out. So the practitioner herself needs to be stronger to do that. I've known a lot of old doctors. They used to do a lot of bloodletting when they're younger because, all of us want to try different styles to see what works the best. But finally, at the end, they don't do the bloodletting anymore. I don't know if it's because they're older or because they just have other protocols that they feel is more efficient and effective or whatever. But Dr. Liao is one of the few that still do a lot of bloodletting. Maybe because he doesn't prescribe as many herbs. The other teachers I've worked with, they also use a lot of herbs. Okay. With chronic pain, how frequent can you bleed? Is bleeding indicated for chronic pain? Yes, bleeding is indicated for chronic pain. You can go back to the notes to check. How frequent? 刁医师，这个病人他们如果需要回来的话，通常您是叫他们1个礼拜来1次，还是1个礼拜来2次？
一般1次就可以。
好 ，Usually they need to return. It's once a week. They don't need to come back twice a week or anything more than that. 那一般他们这些慢性病痛啊，你叫他们1个礼拜来1次的话，那每个礼拜你都会给他们放血吗？
看情况了。看情况，不一定。有些 单纯扎针就可以了，也可以了，不一定要
Okay.
放血。
So he says it depends on the recovery phase of the patient. You don't need to bleed every time. If they're feeling much better, you don't need to bloodlet. Or if you feel like there's not a lot of pain, that means the blood stasis pretty much have gone away, so then you don't need to bleed. I was taught that even reusing lancet pens with replaceable lancet can retain blood and cause cross-contamination. Okay, so if you go look at the link that Myra gave you regarding the lancet needle, the pen has a cover, in the front. And then I think that's where the cross-contamination happens, because with the cap, you can only go in a certain depth. So you can take the pen and then put it on the skin and then do this, right? But Dr. Dell is using it without the tip, without the cap. He is just sticking a lancet needle on the front of the pen. So there's no problem with contamination between the patients, because with the cap, you will have blood, right, on the cap. So that's where the contamination happens. Okay. Somebody asked, are we dealing with a deficient patient here? How are dealing with deficient patient with bloodletting and 30 gauge needles? Claire, that is okay, because he does that all the time. Theoretically, you know how in school we say, oh, don't use 逍遥散 in deficient patients and all. And then if you needle, they're very deficient. This is when they're extremely deficient. Anybody who can still come to your acupuncture clinic usually are not that deficient. You can do that a few times, this kind of gauge 30 needles. But because it's so, you know, the needle hurts a lot, I don't know how Western patients can accept it. You can try it on yourself first. Usually any kind of new protocol I learn, I try on myself. And then I'll know how it works, how it feels. Then you can relate that to the patient. If the knot is squishy and movable, do we still needle into the squishy node? 廖医师他问说吼，这个你在那个找那个痛点的时候，如果这个痛点是软软的东西，就是不是硬点，就是软软的，这样子还是一样扎进去吗？
他有痛就可以扎，就是他说那里痛，你不是很硬就扎了，软软的也可以扎了。
Okay.
扎了以后就不痛。
The squishy and movable, yeah. He said the key point is the patient needs to have pain there. So whether or not the knot is squishy, hard, or not hard, movable, or whatever, as long as there's pain, you needle into it. Will the patient feel heaviness when you needle or just soreness? Okay, that dirty sensation, I don't know what is the best way to describe it. If you guys can help me in the chat room describe that dirty sensation in better English, please help me, because it's I don't know how to describe it correctly. It's kind of like you feeling of distension, feeling of you know, heaviness, soreness, all of that together, you know. It just feels like a lot of chi is there. Okay, so somebody asked, okay, we have been taught not to bloodlet deficient patients. Correct. You don't want to bloodlet deficient patients. That's a general rule. But if the deficient patient is so much in pain, then yeah, you do. It's okay to bloodlet, but don't bloodlet every time. So you just have to kind of see how the patient is. If they're exhausted, then you don't want to do it, obviously. So whatever we learn in school, guys, it's just a general guideline. When I graduated from acupuncture school, I thought I could treat everything until I first saw my first patient. Then I thought, oh gosh, this is nothing like the textbook. Whatever they could tell you from experience that's written down is just a guideline for you. You need to figure out what works best in each particular different patient. Okay, so that's why it's really great to see these masters in action, because in class, you are not gonna, you know, you will just hear these general guidelines. Okay. What does he think of using a 7-star needle, plum blossom needle, instead of a lancet? 廖医师，学生问说，为什么您不用梅花针，要用这个放血针呢？
梅花针我以前用过，现在很少用，因为梅花针可能比较还要痛一点，它在敲
对对，
在皮肤上面，可能比这个比针还要痛。
还要痛。好。So Kathleen, he says that he used Plum Blossom 7-star needles before, but he feels that's more painful than lancet needles, so he doesn't use that anymore. Okay, next question. Angelica, I have heard that bloodletting can be very taxing on the practitioner. Yes. Does he have any tools to replenish him or protect him? OK， 廖医师他说病人那个学生问说，这个您在不是说很累又耗神耗气吗？这个放血啊，那您是怎么样来保护你自己，或者是之后看完病人之后是怎么样保养自己？
我有时候有做那个站桩，或者打个太极，平常都有做。
Yeah, he does 站桩 horse stance, and also he does Tai Chi to keep his, health and also his chi up. How about retaining needles in a cupping treatment? 哦，廖医师有一个学生问说，你有没有先扎针，然后再拔罐，那个针在里面这样子？
怎么了？这个扎针又拔罐？
就是先扎针，然后在针上面拔罐这样子。
不是啊，我一般都不这样子用，分开做。
Okay. Yeah, May, he doesn't like to do that. He didn't say why, but he likes to do them separately. Okay, so that's all for the first round of questions. We're gonna erase them and then go to break and then come back for session case number 2, and then we'll answer more questions. All right? So ready, Myra? Let's take a break. How long should we break for, Myra?
We can take a 10-minute break, come back at 1:35 p.m. Pacific time.